we are actually working on model-based therapeutics applied to intensive care. So in the context of EDITH, we actually focus on trying to develop digital twins applied to control of glycemia for intensive care unit patients. So actually, in those critically ill patients, even though they have no diabetes, they can exhibit hyperglycemia. And it has been shown in many clinical studies that hyperglycemia can increase morbidity and mortality of those patients. So in order to treat this hyperglycemia, the clinicians give the patients insulin, but the problem with insulin is actually that it can lead to hypoglycemia, and hypoglycemia is even worse for those patients. So actually there's a need to have tools in order to provide safe and accurate glycemic control in ICU patients. With our collaborators in the University of Canterbury in New Zealand, we have developed a digital twin that allows to predict the amount of insulin that you should give to the patient in order to reach a targeted glycemic band, in order to reach this safe level of glycemia for the patient. I think the main challenge is to take into account the variability of the patient. So we need to provide personalized solution to the patient. So actually every patient is different, but even in a single patient, their insulin resistance can change over time. So we need to take this into account. So in the solution that we've developed, actually we are able to take into account the patient variability and the patient intra variability. And this can lead to a personalized treatment. So we moved from a one-size-fits-all paradigm to a one-method-fits-all paradigm for glycemic control in the ICU. So we want to provide a risk-based, safe and accurate solution for the patient. And this has already been tested in several clinical trials. It has been shown to be safe, and now we need to work on the acceptance of the solution in the clinical staff, and we are also developing, working on a startup company now in order to commercialize the solution.